Hi everyone, this is Dr. Karuna Kumar speaking, consultant hematologist and bone marrow transplant physician. What is beta thalassemia minor? Is it dangerous to have this genetic abnormality? Should we avoid iron if you are diagnosed with this disease? Are pregnant women at higher risk if they have this abnormality? So first of all, should we call this abnormality a disease? So to know the answers, please watch this video. Beta thalassemia minor belongs to a group of disorders called thalassemia. Thalassemias are a group of inherited disorders associated with defective production of hemoglobin. The severity of the disease is decided by the amount of hemoglobin produced in these disorders. So there are three categories. The first one is major, where the hemoglobin production is almost nil, so which leads to dependency on red blood cell transfusions. So this disease manifests itself at around 6 months of age, and usually the kids, they require blood transfusions for survival. So whereas in intermediate, the dependency on blood transfusion is not as much as in major. They may need transfusion once or twice a year. So whereas in minor, it's also called as trait, these are not affected by the disease, but they carry the genetic abnormality in them. The importance to know minor is, these are the people who transmit the disease in the community. It's very important to screen and identify minors, so thereby we can prevent production of the thalassemia major babies. So thalassemia is a disease which is chronic, and it's cured only through a procedure called bone marrow transplantation. So otherwise the kids needs to be on lifelong blood transfusions. Eventually they develop iron overload, and then iron damages the multiple organs, which can lead to the death of the patient. Usually thalassemia major patients, they survive up to 3rd decade or 4th decade, if not transplanted. So in these patients, it's very important to transplant these patients at a very early age group. Should we avoid iron if you are diagnosed thalassemia minor? Not at all. So thalassemia minor and iron overload, both are not linked with each other. Iron overload is a problem in thalassemia major, where multiple transfusions leads to iron deposition. In iron intermedia, thalassemia intermedia, there is excessive iron absorption which can lead to iron overload. Whereas in minor, there is no such relation with the iron overload. So any patient of thalassemia minor, if they have iron deficiency, they should go for iron supplementation. Are pregnant women at higher risk if they have thalassemia minor? So if you look at normal pregnant women, they have tendency to develop anemia naturally during the course of pregnancy. Say a pregnant woman with HB of 12 grams, she may develop HB up to 10 grams, 11 grams during the course of pregnancy. If a thalassemia minor patient becomes pregnant, so say the patient has a baseline hemoglobin of 8 grams. So during the course of pregnancy, their HB can drop up to 6 grams, which may be difficult for the baby and mother's health. In such circumstances, there may be a little problem to the mother, so where they may require a blood transfusion. So before we give blood transfusion in such patients, it's very important to rule out nutritional deficiency and iron deficiency in those patients. If you look at our Indian population, so there are certain regions where thalassemia is very widely prevalent. So obviously there are many thalassemia minor people carrying the genetic abnormality in them, and it's very important to screen these people prior to marriage. So few countries have made mandatory laws to screen thalassemia minor prior to marriage. Even in India, we will require such laws, because so even two people with thalassemia minor, if they marry, the chance of their children getting a major is 25%. So by just a simple screening test called HB electrophoresis or hemoglobin electrophoresis, we can avoid birth of a major thalassemia major baby.